Good morning, everybody, and welcome to our Thursday morning webinar. It's great to have you along with us. So we've got the lovely Victoria with us. Give us a wave. So some of you will know Victoria very well. She's one of our recruitment partners, and the lovely Laura. And Laura is the wealth of all knowledge and IT bits and bobs, and helps me all the time.
It's a pleasure.
And is obviously in contact with a lot of you during your onboarding phase. So as I've said over the last couple of weeks, this is our last weekly webinar today, and then we will be moving fortnightly. We will be having a recruitment focus on the first Thursday of every month. And then the third Thursday will be myself, and we'll be doing some teaching and education, lots of varied topics, as you'll know from the last few months. So just a reminder, please follow us on social media, Nursing in Devon on Facebook, and Laura will probably post all the social media links in the chat. We've also got a YouTube channel, Nursing in Devon, which is free for anybody. So whether you're thinking of joining us in Devon, or even if you've got people that are doing their nurse training overseas, there's some real good educational resources there in terms of dementia, how we nurse in Devon in the UK. Please feel free, share those resources, because they're there to help everybody. So a reminder, post your questions in the chat. So we've got Victoria here from a recruitment perspective for recruitment questions, and I will endeavour to answer the clinical questions that you have. So I did a incredible interview day yesterday, interviewing a lot of you, and Angela, one of our senior nurses from Torbay in South Devon, came along and interviewed with me. So it's just some feedback really. So Angela hasn't interviewed international nurses before, and was absolutely blown away by the standard of you all, and the wealth of experience that you bring to the UK. So we had a great day, a very high calibre of candidates. So and I'm hoping some of you are watching me now, so please say hello in the chat, and also tell me where you're dialing in from. Where are you watching from? It's always good to know which parts of the world people are dialing in from. And also give us some feedback. If there's something you'd like to see on a webinar, we're open to suggestions. So today we're just going to start with just finishing off that APIE station as part of the OSCE. We all know that is a bit of a beast, and the one people worry about the most. So over the last few weeks, we've had a real focus on the assessment and planning and intervention we covered last week. So this week we're going to spend some time looking at evaluation and linking it into the OSCE handbook that you will all be provided during your onboarding phase. So obviously, as part of your pastoral support, the moment your visa and COS have been issued, and we know you're coming to Devon, you get sent a wealth of educational resources, including the OSCE handbook that has been designed across the Devon providers, and other helpful things like an essential packing list, which tells you what you need to bring with you. And you'll need a coat this time of year because it's cold, isn't it, girls? And it's wet.
So cold.
So cold.
Yeah.
And obviously introduce you to our seasons, which are very different to other overseas countries. And for me, I love the seasons in the UK. I think it really makes it special, and there's always something to look forward to each time of the year. So we're just moving from our autumn season at the moment into winter. So all of the leaves on the trees are golden brown, and things are looking very beautiful. We're just heading into winter. So we'll cover evaluation. That won't take us very long this morning, and then we'll just link it into the OSCE handbook to give you an idea of things that you're expected to cover. And then I had the opportunity of meeting Nalin. Nalin, say hello in the chat. I'm sure you're watching. So I did a pre-recorded interview with Nalin last week, and Nalin is a nurse who's worked and lived through COVID in Sri Lanka. And he also gives us that perspective of what it's been like to work and live through COVID. Nalin looked after his very sick dad through this pandemic. Hi, Nancy. Welcome, Kenya. So we'll watch the interview with Nalin, and I'd really like the opportunity to record some interviews with more of you, no matter where you're phoning in from, because we really like to hear about your story. And you know, we recognise that nurses are tired across the world. We're tired. I'm a nurse. I've lived and worked through COVID, and we're tired, and that, you know, that's why the importance of this type of support is absolutely essential. So if we could just start with the evaluation video, and we will watch the video and then we'll look at the OSCE handbook. But please post your questions and we will answer them in the chat box.
In this video, we'll look at the evaluation process of the assessment, planning, implementation, and evaluation model. This is a written station. There is no interaction with the patient. It is worth reviewing NMC code, professional standards and behavior for nurses and midwives, as this sets out clear guidance in relation to the completion of all documentation. In practice, evaluation could include a wide range of diverse processes. Here, we will focus on completing a transfer of care letter. This is completed when the patient is ready to be transferred from your care to another team. In practice, it is the norm for most organizations to have a transfer of care form that you would complete. At the start of this station, all of the documents that you have worked with or previously completed will be returned to you. Note that you will be asked to work with a different colored pen in order to prevent you making changes to previous entries. The place where the patient is to be transferred to is stated on the document cover along with a summary of the patient history. Pay close attention to this as the scenario may have developed. Note the time given on the document. Some time may have passed since completing the implementation station. Transcribe details to complete all sections of the form, write in full sentences, and avoid abbreviations. Throughout, you should follow the NMC guidelines on documentation. Keep a close eye on time. Completing the form in allocated time is the biggest challenge. When completing the transfer of care letter, some key points to remember are: include patient identifiers at the start of the document. Include all medicines that have been administered and provide details of any medicines that were prescribed but not given. Ensure you sign and date every page of the document, not just the final one. This completes our overview of the assessment, planning, implementation, and evaluation model of care.
Lovely, thank you, Laura. And if you're able to share the OSCE handbook, that would be wonderful. So you can see the evaluation they gave you. It's almost the smallest part of that APIE, that assessment, planning, intervention, and evaluation. You will have the letter there. So if we could just, oh, I saw the book and now I don't.
Or
that's okay. There we are.
The YouTube video kept playing. Here we go.
That's okay. So if we could just work our way down through until we get to the evaluation. So, and I know you'll be tired of me saying this, that NMC standards of practice is so important for you. Okay, please download one from the NMC website if you haven't already. So you'll see we're just working down through this handbook, and we worked down through this handbook over the last few weeks. And you will be provided one of these handbooks when we know your visa and COS has been issued. So for example, we're just, myself and Laura, looking at November cohort arrivals today, and we will be sending out the learning resources for you today. So don't panic if you're a November arrival and you haven't got it yet, you'll get it today.
But if you are before November and you haven't received it, just send us an email and I'll forward you one. That's fine.
Thank you.
All right.
So here's the evaluation of care. So you'll see the template there, and as they said in the video, the scenario will be pre-filled. Okay, please take time just to read through it thoroughly, because there may be some really top tips in there. And as with all of this, you must assume it is today's date and time. So if you're sitting your exam on the 5th of January 2022 at 2:30, you put those details in. Right, so if we could just move down slightly. So the transfer of care letter, okay, so we've got the patient details. Make sure the name and date of birth is completed, okay, and complete each section is full. So part of this is that you're going to be assessed on your documentation standards. So again, please write clearly in this letter. If they can't read it, then you will fail. So they've given an example here. So we've got a surgical example here of a patient that has got sepsis post-op, pain from gallstones. They've been removed today and they're a little bit dehydrated by sickness and diarrhea. Okay, so you would identify the main nursing needs, okay, for your patient. So you'd look back on your assessment and the sort of things there you're going to be looking at nursing care. So we want to relieve pain for the patient. Obviously, the information given is that the patient has got pain from gallstones. So one of our priorities would be that pain assessment and making sure we're offering the patient regular analgesia until they're pain-free. One of the nursing care outcomes could be that they've obviously got a post-operative wound. It's the wound management and making sure the wound management is such so that the patient is comfortable. So we've also got another one there, dehydration. So obviously we want to make sure that we've got the fluid balance correct for our patient. You may want to think about a fluid balance chart. We may want to think about encouraging oral fluids and maybe the use of an intravenous drip, such as normal saline, 5% glucose, obviously dependent on the patient's blood results and urea and electrolytes. But these are all things that you do every single day. Nothing will catch you out. So you would outline the nursing care provided in that box. And please remember, all of this is just to give you a first glance at the OSCE, okay? You will have 3 weeks of comprehensive education and training when you get to Devon. So if we could just scroll down. So on here, again, print your name, sign it, date it. That's really important. And it's really important outside of the exam that we sign, date and print our name for all of our nursing documentation. And all of you know that. So what's a patient's current ability to self-care? So you'd look back at your assessments. So it could be, you know, if this patient is post-op, they're in a lot of pain, they're dehydrated, it could be that the patient's ability to self-care is not very good at the moment. They may need help with toileting, they may need help with washing and dressing, all those sorts of things that you already do. So you'd look at the patient's allergies, okay? So we'd look back on our drug chart. Remember, on the drug chart, there is a section that will say allergies and associated reactions. So you need to look back and document that in this template. So list areas identified for health education. So it could be at your assessment, you've identified that this patient is a smoker. So do we want to look at smoking cessation programs, you know, smoking cessation medications such as nicotine patches, all those sorts of things. And then you would date and time that transfer, sign, date, and complete those sections, please. Okay, those little things are so important. And you might complete a really good nursing transfer letter but fail because you didn't complete one of those little boxes. So a saying we say in England is the devil is in the detail. The detail is so important. Okay, and remember to fill them in. So if we could just move down. So another referral of care letter. Okay, so we've got another example here. So what's the main purpose for the referral to? State who there is referral to. So they've given an example here. So we need the dressings changed post-operatively. We know they've had an operation and they've got a wound. Emotional support following traumatic event. We may need to consider that. And as I've said before, that smoking cessation advice. So just moving down, you'd identify the actual and potential nursing care needs and the activities of daily living which led to the referral. So for example, the need is we need dressing changes post-operatively, okay? So you would write down what the requirement is. It could be that we're looking at making a referral to the district nurses for when they leave hospital, and we would need those district nurses to keep an eye on that wound when they get home. You may want to put down they would need an initial assessment. The district nurses will go out and make that assessment and then base their visitation on how the wound is at that time, okay? So you'd outline the nursing care provided to meet the identified needs. So you probably specify here the wound care that we're doing at that moment. So it could be that we're applying a non-adhesive dressing with padding for comfort. You know, it'd be dependent on the wound and how things are. So if we could just scroll down a bit. Oh, we've got someone following, just come in from Ghana. Welcome, Ghana. Again, and you would just work down your way through again this template, looking back at your assessments, looking back at your drug chart. All that information is there for you. Like I said, they don't want to catch you out. You just need to use the information that's been provided. So list areas for patient education, as I've said before, smoking cessation. And they also gave you a tip there that they may need some psychological support. They may have been really traumatized from this surgery and becoming poorly and septic afterwards. And you need to detail how you would meet the patient's needs. Okay, if we could scroll down slightly. So common care by nurses in planning, you would explain the care plan. You know, monitor those informations using our early warning score. If that's something that you're not used to using in your country, you will be made familiar to that in your OSCE education. The pain, we assess pain in the UK using 0 to 10 pain scale, okay? And that's something part of our regular comfort rounding in the UK. We check the patient is okay. Do they have any pain? Okay. Now, dependent on what organisation you go to, you might have different comfort rounding charts, but you will all be made familiar with that in your education. And again, there's suggestions here. You know, their breathing, you would assess their respiratory rate. They could be asthmatic, they may need nebulizers, inhalers. They may need to be taught inhaler technique. I think we've all come across patients before that have been asthmatic for years and have a really poor inhaler technique when they come into the hospital. So just moving down slightly, we've got anxiety and depression here. So you would use what we call the PHQ-9, and you will be made familiar with that during your training. And it is also one of the appendices in this OSCE handbook. That's a patient health questionnaire, and you would work your way down through there, okay, and it gives you a score at the end of it. It could be that the patient's on antidepressants, and obviously we would monitor that and prescribe it as given. And scroll down, please. Oh, Laura, could we just scroll down a little bit, please? Oh, Laura, are you able to scroll down? Oh, I think we've lost sound with that.
Oh, sorry, my computer froze. Sorry. What am I doing? Am I scrolling down?
Just scroll down slightly.
Yeah, that's fine.
There we are. So all these activities of daily living are there. Nutrition, pre-op, safety prep. Are they nil by mouth? Has the consent been done? Is it been completed properly? Is the patient aware of the procedure they're going down for? Making sure they're informed. Looking at things like TED stockings, which is our clot stopping stockings, anti-embolic.
They're very beautiful, aren't they?
Oh,
very beautiful.
They make you look very glamorous. If any of you have experienced TED stockings, yes, very.
I have got
glamorous.
some from when I had my daughter. They're lovely.
Dependent on what hospital you work in, you may get a variety of colours, or you may just get very glamorous skin colour.
No, I had a lovely bottle green. It was beautiful.
Wow, very nice. Very nice. So that risk of infection, assessing, you know, we would be looking at the wound all the time, wouldn't we? How does it look? Does it look red? Does it look inflamed? Is there any discharge? Is the patient in any pain? All of those things you already do. Okay, scroll down, please. Are they at risk of bleeding? They will be, won't they? Because they're post-op. Risk of falls. I think that's drummed into all nurses, isn't it, from training? Is the patient at risk of falls? And it's something we're really hot on in the UK. You know, are they in a high observation bed if they're at risk of falls? Can we keep an eye on them? Things like, have they got the buzzer nearby so that if they need a hand to the toilet, can they ring us? And it's all about having observation, isn't it, with patients that are at risk of falls, making sure we can see them. Hi, Chida. Welcome, Nigeria. We're so excited to have you here too. And also assessing future risk for deterioration. And that would be based on our assessment and our observations, and I tell you what, when we interviewed yesterday, some of the interview questions are quite clinical, and you know, making sure we've got a clutter-free environment is so key, and to hear those in the answers yesterday absolutely made my heart sing. We know that sometimes patients come into hospital with suitcases full of clothing and their own belongings, and it's really important to have a clutter-free environment. And it's something that was always drummed into me as a student nurse by our older nurses, you know, and actually it's so important, and I think we've lost sight of that, having their bedside table clutter free, because actually if you need to get to a patient in an emergency and you have to wade your way through clothing and old newspapers and rubbish and suitcases, it's going to delay the time. So that is really important. Clutter free environment, making sure there's no spillages on the floor, making sure you're not going to trip over oxygen tubing or leads that's connecting to monitors. That's fundamental. And as part of your OSCE, as you approach your patient, you will be expected to say out loud, which feels a little bit alien, I'm assessing the area for any signs of clutter, any risks of tripping and any spillages. I'm going to assess, and now it's free to approach. So they absolutely will mark you on that. And ensuring the call bell was in reach, okay, making sure the patient's got the call bell there in case they need us. You'll be assessed on that also. Scroll down, please. Right, so we'll just whiz down through the OSCE checklist, and then I'm going to round up the evaluation. So if we could just scroll down, this is our assessment station checklist that we've already worked through. Planning, so we move on to P. Implementation, that we did last week. And then our evaluation, okay? So this is our checklist. So the assessment is to, the nurse will safely evaluate the care of a patient and safety plan for discharge transfer in accordance with the NMC standards, okay? So we could just scroll down. And that's the learning contract you will be expected to take part of. And as I said yesterday, you know, it's really important for that 3 weeks of training, you will fully submerse yourself with the OSCE education programme. You know, you will live and breathe it for those 3 months. You'll probably arrange to meet up with other colleagues at the weekend to practice with each other. And obviously we've got the internet, you can do that on Teams as well, meet up with each other. That's really, really important. Right, okay, so a bit of a whistle-stop tour of evaluation, but it is quite a short test, an OSCE station. So I'm really like to move on to the interview with Nalin that I recorded last week. So Nalin, thank you so much for joining me last week. We're going to play the interview, okay? And so I'm going to put myself on mute and put my camera off while Laura plays the video. Keep popping your questions in the chat box. I will continue to answer, and we will please let me know what else you want in the future, okay? And then I'll come back after the interview and sum up. Thanks, Laura.
Perfect, no problem.
So good morning, everybody, and welcome to our webinar this morning. So just to let you know, this interview has been pre-recorded. So I've got great pleasure in introducing you to Nalin. So Nalin is currently a nurse practicing in Sri Lanka. And Nalin is looking on coming to working with us in the Devon IR hub and within one of our fantastic hospitals some point next year. So I know that you're currently studying for your English exam, which you've got in the month of November. So the reason I've invited Nalin along today is because I think we really need to remember to look after ourselves and our self-care. You know, as nurses, we have all worked through a global pandemic. All of us are quite tired. We've been under considerable stress, a lot of high levels of emotional labour through the last 18 months. A lot of us have had personal loss as well, and it's been a really difficult time. So I really wanted to use this to focus on all of you as individuals and the journey that you've had. So Nalin, welcome to our webinar this morning. And I would like you just to start off and talk about yourself and where you work and the hospital, and we'll take it from there. Is that all right?
Yeah, that's fine. Carly, it's nice to see you, and I'm very privileged to have a conversation with you, and especially it's a great privilege for me. Actually, I'm Nalin. I'm working as a nurse in Sri Lanka. I'm working in the main hospital of the Sri Lanka, which is situated in the heart of Colombo. And I've been working there for 7 years now. I have been working in an intensive care unit, and now currently I'm working in the orthopedic section. So that's my introduction for briefly, and I'm looking forward to coming to UK and enhance my experience. And apart from that, I like to share my experience regarding nursing in Sri Lanka and the current situation we all are going through because of this pandemic. And I know this is a global situation. And I like to share my experience with other colleagues and all over the world.
That's wonderful, Nalin. So tell us from the start. So, you know, right at the beginning of the pandemic, when we started to see COVID levels goes up. So how was that for you as a nurse working in Sri Lanka? Tell us what happened.
It's in our country, we faced the first COVID outbreak in beginning of 2020 actually, and we had some kind of numbers, like small numbers initially, but our government and the hospitals didn't take it much, but suddenly the patient numbers has risen, and all the people got shocked. And actually for ourselves also, it is a kind of a news experience. We didn't expect this kind of a situation before, we in our lifetime. We have been actually our government anyway help us to go to overcome of these things. In the first COVID outbreak also, we were managed to fight it. And after some time, like when the patient numbers are getting lower, and we had a quarantine procedures and island-wide lockdown procedures, and initially we didn't have any facilities even. I can remember we didn't have any equipment to wear. I can remember I asked one of my colleagues to contact a local garment factory to arrange us a polythene PPE kits for us.
And aprons.
As a donation. Yes, as a donation. That was a really tough time. We didn't know what to do actually.
So you were looking after patients with confirmed COVID without aprons and PPE and masks.
Yeah, that's it.
And can you remember how did you feel at the time? How did you and your colleagues feel?
It's like we were on a phase of constricted. We were like, our feelings were constricted, and we don't know our limit. We didn't know our limit of how to deal with the situation. And if even we have to protect ourselves, and we have to protect the patient's self also. Anyway, sometimes we had to put ourselves second. Our situation in my life, sometimes we have to insert cannulas, and sometimes we have to give oxygen to the patient without going having PPE, proper PPE, because we have to consider that his life is in danger.
Yes.
And some kind of, because not for the COVID, might be some kind of a situation. So we consider that, and every staff were managed to get through. Anyway, I think in that particular time, all the nurses were had the urge to work. They didn't take any leave. So otherwise, most of the time, our working schedules are very tough. But in that particular time, I can remember they were all together managed, and somehow they get the help of other organizations, and they managed to get sometimes they have the nurses in my hospital were sewing took the machines from the outside, and they were sewing all the PPE at hospital.
Wow.
They
so
arranged those stuff.
So staff were actually sewing masks and things for the staff to wear.
Definitely.
And
that's our initial start. Anyway, that our patient number has got down actually in the first phase of it, and we didn't have any vaccination, and it was all coming. We were expecting, but it's always coming.
I remember. Can you remember how you felt? So when the pandemic started, and I'm a nurse and I worked through the pandemic, and I saw lots of fear amongst nurses. People were scared because we didn't know what to expect. There was a fear of catching COVID and taking it home to our families. And is that something that happened?
Yeah, that's happened in Sri Lanka as well. There were we had to separate facilities for each and every COVID patient. We had to. There was a separation procedures for our hospital also, but even though we didn't get the patients right away from the admission, there was a high chance of patients in our hospitals are getting positive because of they are being already contacted with the visitors and outside and all. So for that, we were trying different kind of things. As a third world country, and our ICU beds are also limited. We don't have much ICU beds. Even in the COVID care hospitals also, they do not have enough ICU beds. And they try to minimize the patients who are going to critical phase.
Yes.
Sometimes, yes. In Sri Lanka, I think there was people are much concerned about the herbal and Ayurvedic medication.
Yeah.
So even people had to go to that particular treatments also to get rid of it. And I think there is no scientific evidence or no scientific research done, but I know that there are also some kind of effect on the patients not getting bad, even though they get COVID. Among the staff, there was a fear that they would bring the disease to their families, but they were taking different kind of precautions. Some nurses who have little children at home, they have to bath several times before they go to hospital. They have to go to home, and anyway, they were very conscious and very informative about the infection control methods, and we received already through our education. Actually,
did any of your colleagues actually catch COVID from working?
No. In our particular ward, in my section, mostly I'm in a surgical ward.
Yeah.
In my section, the number of nurses who have got sick is less. We have other categories of other healthcare assistants and all this. They have got that, but lesser number of nurses have got positive in our section. But in other sections like medicals and other COVID related wards, they have some sort of few numbers, but compared to the other countries and other numbers, I think we had a lesser number of nurses who have got positive, and even they didn't get worse. And only we have 3 or 4 nurses in other parts of the country has died from COVID because of their other complications, also sometimes because of the old age and different chronic illnesses, I think.
And I'm aware that your father became poorly, didn't he? You know, during this pandemic.
Yeah, it was almost a third wave, in the third outbreak in our country. It's Delta outbreak in our country. It was like 2 months. We hit by it in July, I think. We started our patient numbers has got risen suddenly, and government also was not ready, even though the vaccination procedures are going on, and there was no enough time to do it. So even my dad also has been vaccinated with the first dose of the COVID, and he has got a Sinopharm first dose by the time he has fallen sick, and he has suddenly got septicemia due to his condition of one leg, and he has high fever and he was vomiting. One time, I also limited myself to getting his contacted because I'm working in the hospital. If I carry him the disease, and I had the fear, and I was time to time visiting him, but by the time his condition got bad, his sugar level came up, and by the time it was unmanageable. So when I reaching him, he has high fever, and I was thinking he might be have contracted with the COVID, and even my family members also thought like that. So we were signified that there's a wound in already, but our judgment was cloudy because of the whole situation in the country, and we were almost about to get locked down also at that particular time. I can remember there was I took him with the ambulance, and his situation was that much critical, and he didn't he wanted to apply oxygen on the way to the hospital, and as being a nurse, I think I had that privilege. You know, as being a nurse, and in Sri Lanka, we don't carry a patient to the hospital always with a nurse. Most probably the other citizens don't have that privilege to carry the father in an ambulance with a nurse. As being a nurse, I had that. You know, I care of him, and on the way also, I checked his pulse oximeter, the mobile pulse oximeter, and I was totally scary because of whether I had my father there's higher chance. We don't know there's an outbreak was going on our area, in our neighborhood also, and I was thinking, yes, I will face this, and I took him to the hospital, but unluckily they have to put my father into the COVID patients ward. You know, there are medical ward. There are medical ward. They didn't differentiate between the septicemia and the COVID.
Yes.
So I have to take him to that, and their rapid antigen test was done, and it became negative. And after that, I think his level of conscious was getting down. I thought that would be because I had a belief that this might be because of septicemia. Even the doctors told the same story. It's unlikely to be the COVID, and but there's higher chance where even though that my father might be positive negative, but in other parts of the ward, particular wards he has been treated, is full of COVID patients, and there are post-COVID patients, and the patients who are still getting diagnosed,
And
with
were you
COVID
able to visit him on the COVID ward?
Yeah. Even I can remember the doctor said that rapid antigen is negative. Your father's rapid antigen is negative. Would you go for PCR? So then obviously I was thinking, yes, I had a first chance that my father's rapid antigen might be negative. If I do the PCR, if it got positive, I would lose him. They would take him from me and my family, and I would not be able to. So I requested my doctor not to do PCR, and we would go because he has already swollen leg and wound in the leg, and we consider this as this, and we will start treat procedure. So then they did some X-rays also on the chest, and they try to identify the COVID related changes in the lungs, but they told that there was no significant changes. So then they proceed with that without doing PCR. So that was really tough.
Can you remember how you felt? So obviously you've just you've worked through the pandemic, and then the third Delta wave comes along. Then your father is poorly. How are you feeling about this as a time? Because obviously you're a nurse, but you're also a son.
Yeah, it was absolutely no difference between a normal person or being a nurse. I think the feelings would be the same. It's towards our loved one. Even if it has happened to a patient, he would also feel the same situation. The father towards their parents. Their parents are parents. They are the only one. I only have my father. I don't have my mother died 6 years back, so that was a fear. I had a fear.
It's very hard, isn't it? It's very hard when our loved ones are actually poorly, and it's not very nice being on the other side when we are so used to being the nurses, and actually then we put our trust in someone else.
But for me, I can remember I was terribly wanted to take my father to another ward where there is no COVID patient. So I asked my superior that my managers to whether I would be able to take him to another ward without COVID patients. So they told that almost all the hospital, almost all ward have the patients of COVID. So then I was thought, okay, I was down, but I can remember one manager, matron actually, he told me, Nalin, don't worry, you have all the knowledge, and take a separate thermometer to your father, separate items to your father, follow the infection control methods. And every time I can remember, I didn't touch him without washing my hands. I followed all the procedures, and actually it was my knowledge, and she encouraged me to use that knowledge. Actually, that's being a nurse was very privileged. I can remember, and when I'm doing the care to him, also it's like as I can remember other patients how the other patients are doing, but I can't help everyone. I'm taking care of my father, but I also felt that also.
So did you provide all of his care? So did you wash and dress him and everything?
Everything I had.
Yes, and is that?
Yeah, at the meantime, he has got diarrhea because of the antibiotic. He has got the diarrhea for the IV antibiotic, so I have to manage with that. So
yes.
Anyway, for him, I think only me, because all the staff is also busy with the other patients, COVID patients. There are dengue patients also. In Sri Lanka, dengue is the main outbreak. On that particular time, dengue is also an outbreak.
Oh dear.
Yeah.
And is it in Sri Lanka? So is that a normal? Is it not part of your normal culture that relatives will come in and provide care to their relatives?
Yeah, but in that there is a culture. There is in our culture, if a person is fallen sick, a lot of visitors. There will be a lot of visitors. There are loved ones and there are neighbors and coming. But in that particular time, my family was not able to visit the hospital because the visitors was restricted due to COVID pandemic. You know, I can remember even my colleagues were also not able to see my father. They came to visit, but they didn't allow to come.
Well, how is your father doing now?
Yeah, he's fine, and now he's with my elder sister, and she's also a doctor and Ayurvedic doctor, and she's took care of him very well. And I can still remember when I was taking him to the home, you know, after he's getting well, it's like, oh my gosh, I got through. I didn't expect just, you know, taking patient from ambulance, which is the ultimate thing, you know, taking a patient, you know, that your own father. That's my ultimate what do you call it? Fulfillment, I think.
So
in the same way, I took.
You obviously did a very good job looking after your father.
Yeah, I think related to my story, I think nurses have that knowledge. You know, sometimes we are getting depressed and we feel outbreaked, and the things we are doing and things we are offering to others and the care we provide gives us the more experience and courage to look after if someone got sick and even ourselves also. I think can be related to ourselves.
Yes. And I think as nurses, we give so much care to other people, and I think it's very important that we take care of ourselves. So obviously, Nalin, you went through that very stressful period of the pandemic, and then looking after your father in hospital. You know, so how did you look after yourself during that time?
It was like I give up that part. Actually, I had to give up that part. I was not sleeping for 5 days. Yes, until I took my father to home, I was had a little sleep actually. Luckily, there is one of my friend who's with me for all this situation, and he provided me all the support, and he gave me foods, and even my family also brought me food to hand over to my father. And I look after myself. I had to look after myself. Put myself second, and you know, in the meantime, I was thinking. I got nutrition, and I took because it's essential. Even though I didn't sleep, I have to have much nutrition, otherwise I would fail. So when there is sleep depriving, I can imagine. I can remember still when there was a memory still relapse. You know, sometimes I was not able to take correct decisions regarding to my father. So then I took some sort of food or something to drink or something, and so that's why I cover up myself. And it's tough time, but it's gave me a lot of experience and fulfillment actually.
Yes, and I know that you practice a lot in meditation.
Yeah, it's meditation is a part of my religious practice. You know, after my mother's death, and I got close to the religion. You know, even my mother is also very spiritual, related to Buddhism, and I got closer to it. And being a nurse and being a spiritual person, and I was giving some, even while working also, being a spiritual person is not only beneficial for us. I think being spiritual or whatever the religion, being spiritual is very beneficial for the patient. You know, you can feel that empathy. You know, empathy is a kind of a thing that you should put for every patient. You know, otherwise you would not feel that. You know, you would not be able to recognize problems in them.
Absolutely, and spirituality is absolutely fundamental in nursing practice, you know, across the world, and also in the UK. That's something that we really focus on, because like you said, you know, spirituality, that is a core need, you know, when we look after our patients, and we have to consider that when we plan our care. So what benefits would you say meditation provide for you as a nurse?
There are a lot of benefits actually. First of all is the calming down the stress. Even, you know, when I'm working also, after doing 3 or 4 nights in a row, you are getting so tired and your brain is getting tired. And so once you are spiritual and you have that fulfillment and you follow that, and the meditation, you would not be able to do the meditation all the time, but in the meantime, your practices will bring you some peace within our busy schedule, you know.
Yes.
Sometimes we can't change the works, the duties we have to fulfill, but ultimately it gives us some kind of a refreshment. That is what you know. After busy shift, after doing some shift, I feel like to get energized, I do some meditation to get energized. Really, if I engage those stuff willingly with my whole heart, I feel like it's resonate my whole body and all the areas. By so far, I've been checking my blood pressures and also sugar levels by time to time. I think those are getting okay also because of that. I don't know.
Yeah, and I think it's really important that as nurses we have techniques in how we deal with our emotional stress, and you know, I'm sure definitely many nurses that watch this video will completely empathise with that feeling of feeling very busy in your head after a few shifts, and it's just having that the ability to have emotional calm and peace, isn't it? And the way you do that is with meditation, which is really interesting.
Yeah, definitely. Meditation give me a lot of concentration as well. You know, when we are working also, the concentration is a very essential part. You know, otherwise we would miss up some sort of error, mess up with some errors or medication, or sometimes the things to do, essential things to do, we can miss. I think if you develop concentration with the meditation, those tasks would be not missed. I can guarantee, it's 100% guarantee. I have been practicing for like nearly 7 years now since I started work. So I think those things develop the concentration, and you would not miss anything related to the patient care.
That's great, Nalin. It's been really interesting talking to you about your experiences working through the pandemic and as a nurse in Sri Lanka this morning. And you know, as an NHS and as a Devon IR hub, we really recognise how important the health and well-being of our nurses is.
Definitely.
And nurses that come to work in Devon, you know, will have a comprehensive health and well-being package that they can access at all times. So I know that are you taking your IELTS next month? Is that right?
Yeah, I'm trying hard. And luckily, I need to practice this today. I'm lucky. I can't remember. I got 49. Oh no, out of it's like, oh my gosh, it's 39 for reading. My God, 39.
Wow.
That is the first time. 39 is like, score is around 8.
I think your spoken English is very good, so I don't think you need to worry about your spoken English. It is very good. And so what can I just ask? I just want to ask you, so what attracted you to come and look at the Devon IR hub then, and the things that we offer?
First, Devon, I got through in the Facebook, and I saw that there was amazing outlook actually on the beaches. First, I was, oh my gosh, what is this? Is this UK? So then I I looked into some of the presentations and webinar, and especially by Laura, I think. It was so interesting, you know, the way you describe about the things and way you gives the care in the hospital. They already mentioned about those stuff also.
Yes.
And I think the surrounding area would be also definitely better.
Yeah,
So then
beautiful.
I thought I guessed seeing all those stuff in the page and the thing. I think it was that area would be a better place to live as well. You know,
Yes.
I think there are many good hospitals. I think yes, there's especially one called Plymouth, right?
Plymouth, yes.
Yeah, it was. I attracted very much by that information given. It's amazing place to work, I think.
Absolutely, and they'll be very lucky to have you. So, Nalin, thank you so much for coming and speaking with me today.
Yeah, it's very privileged, and I feel it's very effective, helpful for me to have a conversation with
Yes.
you to improve my English also. I
Absolutely.
wish everyone had the same opportunity to do that. Every
No,
nurse.
absolutely, and you very eloquently told us about your story today, and it's wonderful to hear from you. So, thank you for coming, and obviously this is a pre-recorded interview which I will play at the webinar. All right. So take care, Nalin, and I'll speak to you soon.
Yeah, thank you very
Take
much.
care. Bye.
That's that.
Lovely.
Lovely. Thank you. Yeah, it was
Nalin.
lovely.
And I'd like to do the same with some of the others of you that are on the call. I'd really like that opportunity to have an interview with you and listen to your experience of working and living through COVID in your country. So if any of you would like that opportunity, I will put my email in the group chat. Please email me and we can pre-record it, and I would just love that opportunity. So I think we were just going to whip down through some of the questions. I know we've had a question there about bringing over families and things like that. So I have put my answer in the chat, but just to clarify, so we strongly recommend that the nurses come along on their own to begin with and focus on their OSCE and get their PIN number, which just takes a couple of months because we don't offer family accommodation. Obviously you get 8 to 10 weeks of free accommodation on site on arrival, but by the time you've done your OSCE and PIN, you can then start to look for your own accommodation, and our nurses bring their families over at that point. So that's what we advise, because we don't have the family accommodation. Just seeing if there's any other questions there.
Yep, so we've got a question about vacancies for international nurses. So we are always looking for international nurses for our vacancies, always hiring general medical and surgical nurses. But of course, if nurses have a specialty like ICU, paediatrics, ophthalmology, gynecology, any specific specialties, put that in your subject of your email and then we'll get to it quicker. But we're always looking for nurses. So if you email us, we ask that you have 6 months post-registration experience, as well as a valid IELTS or OET exam. You've completed your computer-based tests with the NMC and are registered with them.
Lovely, thank you, Laura. We're going to do probably next week, we're going to do our first Facebook Live event. So we're hoping that that's going to sort of reach more of you out there. Please tell your friends about us, like I always said. So we're going to do our first Facebook Live, which again is interactive, and we'll probably do it on the offer, so that those of you that are looking for vacancies will know what the offer is in Devon, which is it's an incredible offer, I have to say. So we will advertise that on Facebook and we'll go live. So make sure you're following us on Facebook, Nursing in Devon. So I think that brings us to a close, really. We've just run over time slightly. I hope that's been helpful. please email me your thoughts and any feedback on what we could do in the future. So big thanks to lovely Laura and the lovely Victoria from the recruitment team. We're always here to support you and answer any questions that you've got. So remember, look after yourself, most importantly, okay? And the next webinar will be a recruitment focused webinar and will be the
1st of November. 1st of November?
No, don't confuse me. The 11th of November, no, the first Thursday. So so it will actually be the 4th then, won't it? Because we're going to start
next week.
Yeah, so the first Thursday of the month will be recruitment, and then 2 weeks later will be myself again. So we'll see you next week. Recruitment focus, and take care. Have a great day, everyone.
Bye, everyone.
Bye.
Bye.